Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education, which is actually Integrative Movement Institute, IMI. Welcome to this edition of Facebook Live. Happy Tuesday. Hope your week has started out well and you're out there empowering your community. One of the things we've been discussing here in the last few episodes of Facebook Live, thank you for being part of our community, is the importance of knowing your functional anatomy, especially around the spine and how it relates to your client's posture and to, more importantly, their movement, and why some of your clients don't perform at the levels they need to and or want to, and why some of your clients experience chronic issues like chronic tightness or discomfort and or just the inability to perform at the levels they need to and or want to. So the last couple episodes I talked about the difference between the deep and superficial muscles of the core and how you have to train them differently, however, also teach them how to work together. And just hoping your training is going to target them equally is kind of like throwing a quarter to decide if who's going to win the game or something like that. It doesn't really work so well. So you need a specific approach to training different systems of the body, the deep myofascial system or the deep muscles and connecting fascia, as opposed to the superficial muscles and or fascia. Which brings us to today's conversation about the deep and superficial muscles of the neck and the forward head posture. Because I want to ask you a question. How many of your clients that you work with, especially if you work with an older population, you know, the baby boomers, senior population, the active aging population, what percentage of your clients that are coming in to see you have the forward head posture? Now, if you are following social media, you may read things or hear things or have people, some of your colleagues say things like, oh, posture doesn't matter. Just look at the studies, the research studies, and they'll tell you that posture doesn't, there's no correlation between posture and pain and posture and anything else. Well, if you take a sample of 100 people, so just say you took 100 people over the age of 50, so 50 to 80, you took a random sample of 100 individuals that all have what we classify as a classic forward head posture, right? Kind of looking like this. And if you did a poll of them and you had them answer some questions, you'd find out that some of them have pain, some of them don't. So the authors of looking at, the researchers looking at a group of those 100 individuals would come to the conclusion of, well, see, forward head posture doesn't seem to correlate to whether you have pain or not. It doesn't say that the forward head posture doesn't matter or that people that have the forward head posture aren't more likely to have pain. It just says that it doesn't seem to correlate in that sample population that they looked at. And also, so then some of your colleagues or the people in the industry would be like, see, research proves forward head posture doesn't matter. However, you have to keep looking at some of the research and you also have to use some common sense. Because there's a research study that came out recently in the last couple of years, I think it was 2018, 19, actually it may have been 2020. They took a group of young individuals, about 20 to 30 young individuals. So small sample size, however, young, healthy individuals with no neck and or head pain, okay? Or surgery or trauma or anything like that. They forced them into, or they put them into, they had them assume that forward head posture. And then they went back and looked at them a few, I forget how long it was, but very shortly after. So maybe it was 20 minutes or an hour, whatever it was. What they found was virtually all these individuals changed their respiratory rate. They started to breathe faster. They started to breathe more shallowly just by having them assume the forward head posture for a very short period of time. So you could be like, so what, Dr. Osar? That doesn't really matter. So here's the thing. 20 minutes or whatever it was, maybe an hour, 2 hours, whatever it may have been, very short period of time to change the breathing strategy of young, healthy individuals. Now think about that. Young, healthy individuals already showed changes within a short period of time. Now think about your older clients. People my age, in their 50s, or your clients in their 60s or 70s. Your clients have had long-standing medical issues. Maybe they've had history of surgery, open heart surgery, or even laparoscopic surgery. maybe they've had chronic pain, maybe they've had trauma, whiplash, car accidents, things like that that have impacted their head and neck muscles. And if you also look at the research by, I believe it's Gwendolyn Joel, I saw her many, many years ago when I was first in practice. Gwendolyn Joel is out of Australia. She's done a lot of research and work around chronic whiplash injuries. And what she showed is there is a change between the deep and superficial muscles in individuals that have chronic whiplash. And you think about this, some of your clients have been in very significant car accidents or multiple car accidents. Maybe they're involved with sports and or were involved with sports where they had neck trauma. Like maybe I had a client right now that my wife and I are working with. She actually fell off. She was a horse rider when she was a young girl, and into her teens, she fell off her horse. I think it was actually when she was 18 or so, fell on her head. And even as we look at her now, her head is quite forward. She's changed her thoracic posture, and it almost looks like her face is quite distorted. When I say quite distorted, it's relative. Like she's a little more compressed. She's a little more compressed on the right side of her head and neck, and that's the side she also has shoulder issues. So we start to see these changes in between, or should I say, in relationship between the deep and superficial muscles. What Gwendolyn Joel's research has shown is that the superficial muscles, like the SCM, so these muscles that sit right here in your neck, that are largely responsible for pulling the head and neck forward, the trapezius and the scalenes, even those muscles, even though they're very important in respiration, they will oftentimes become overactive in the forehead posture, that these muscles start increasing how much they're activating and how quickly they're activating to sudden perturbation or sudden changes in movement. These muscles, these other muscles, the deep neck flexors, DNF, deep neck flexors, or the deep neck extensors, like the multifidi muscles, those small, tiny little muscles that sit right up against the spine. The deep neck flexors are the muscles that are deep inside, underneath the SCM, underneath the scalenes, deep up against the spine. These muscles become delayed. The individuals start to change the cervical spine posture. That should be lordotic. They start creating more of a straight neck posture and even a flexed neck posture. And oftentimes when this individual, like my wife and I are seeing, when they come into the office, they've been to physical therapists already. So what they often have them do in physical therapy is just do these neck retractions. And if you put your other hand, so take your left hand, put it on your chin, take your other hand, put it on the back of your neck so you feel your cervical curve. Now do chin retractions. And what do you feel your cervical spine doing? You'll actually feel your cervical spine start to flatten. Flattening means it's flexing, which means you're overactivating the flexors of your neck compared to the deep muscles of the neck, which should be helping to maintain the normal lordotic curve of the neck. So we start to see changes in the activation between these two groups of muscles, which changes the curvature, which changes and perpetuates a lot of these habits we start to see, or these issues that we start to see in our clients. So again, how does that relate back to what I talked about earlier, breathing? Well, the muscles, I should say the nerves that innervate your diaphragm are C3, 4, and 5, coming out of the cervical spine. We had a way of learning that, or I should say remembering it in school. C3, 4, 5 keep the diaphragm alive. These are the muscles, I should say these are the nerves that go down and innervate the diaphragm, the main respiratory muscle. Well, if you change the neck position, you start to overload and create tension, neural tension on those nerves going down to the diaphragm, then you could potentially change your client's breathing or the individual's breathing. And that's what the researchers concluded in that first study I shared with you, is in those young individuals that you're likely changing the tone or the information, I should say, in those nerves that are going down to the diaphragm. Now let's fast forward to your clients that are in their 50s, 60s, and or 70s, and now they've been in this forehead posture for a long period of time, decades even. They've had cervical trauma, whiplashes, concussions, things like that. They may have had open heart surgery and or other surgeries of the shoulder and or back that's changed how they're using these deep and superficial muscles. Now think about how that dramatically changes their breathing pattern. That's why it's important to understand the difference between the deep muscles and superficial muscles. That's why it's important to understand the research, how to interpret it, how to use it, and what the research is really saying for every research study you find that shows no benefit, you'll find research studies that also show benefit to doing a certain strategy. So it's important that you understand this information so that you can make educated decisions that ultimately help your client achieve their health and fitness goals. So that way you differentiate yourself from the rest of the fitness professionals or the health professionals that are out there, and you clear up some of that noise that's in our industry. Because if you watch social media, there's lots of noise, and your clients are going, and your potential clients are going, listening to this noise. They don't know how to differentiate this information. They just go to whoever's the sexiest or loudest, or the person that puts out the most amount of posts. That's where they're getting their information from, the influencers, right? So we want to help you differentiate yourself so that way your clients and your potential clients know where to find someone who understands how to work with them and can create the most optimal strategies. That's how understanding anatomy can help you. It's not so you start spouting off muscles and, oh, I know the deep neck flexors, I know where they are, I know what they do. Let me impress you by my knowledge. No, it's so you understand how to, number one, assess your client, use this information to assess your client, to identify why your client is having these issues and what your assessments are telling you, then how to use the most effective corrective exercises to help your client create more optimal strategies with the information. So that way you choose the most effective exercise. You help your clients create the best strategy for improving their posture and, more importantly, their movement. So you understand and can educate your client why certain strategies may not work so well, why neck retractions may actually be leading them into further dysfunction rather than becoming more optimal or more functional in their posture and movement patterns. That's why Jill and I created two Anatomy Geeks, to help you create a resource for you so that way you could find and learn great information regarding functional anatomy. We also want to make sure that this information wasn't just like a bunch of knowledge, just spewing a bunch of knowledge like, a lot of your anatomy classes may have done in school. If you had anatomy, I had literally a dozen anatomy classes through 10 years of college, probably more than that. Lots of continuing education about anatomy. And most of it was just like, okay, here's the information, go learn it, and hopefully it works for you. Right? That's how school kind of was, right? They're just force feeding you tons of information. We wanted to take anatomy so that it could be applicable, or I should say practical to the clients you work with. So not just you have the knowledge, so that you can actually apply it to your clients, so that you know how to use your assessments to find out your client's current posture and movement habits, because that's what your assessments should be telling you. And then also to use this anatomy knowledge to help you choose the most effective corrective exercises so that you're training the deep muscles of the neck or core or rotator cuff or hip or the ankle and foot, depending on the body part that you're learning about. And then you also have the most practical way to blend the deep and superficial muscles, because it's not enough just to train these muscles. You have to teach your client how to use these muscles and integrate it with the more superficial muscles so they can do the things they want to, so they can do the exercises you want them to do, so they can get out from your sessions and use the strategy you're helping them create to do the things that they need to and want to and love to do in their everyday life. And that's why Jill and I, as I mentioned, created two Anatomy Geeks. You've heard me talk about this before if you're part of our community. Two Anatomy Geeks was really started sort of as it's kind of a joke. Jill is my colleague that works in our office. She was a student of mine in massage school 21 years ago. I mean that's how old the two of us are. We're both in our 50s now, and it's a thing that 21 years ago that she was a student of mine. Now she's working in our office. She's finally, we're finally back we've been back, but Jill's back now, working back in our office. But through the pandemic, we started this two Anatomy Geeks series to help support fitness professionals just like you, so you could learn and up-level your skills, your knowledge, and your skill set during the pandemic. And people really, really loved it. And we love our two Anatomy Geeks community. Many of you that are watching this are part of our community. We love this series. We love doing this series because it's such a fun way. Jill makes it fun and practical. She has great ways of showing anatomy on a skeleton, great practical designs of how to think about anatomy, how to look at anatomy from a different perspective. And we, again, make it practical. So what we did is we created modules. We have 3 module series on the head, neck, rotator cuff, elbow, wrist, and hand. So that way you learn the functional anatomy of these different areas in small, practical application. So again, each module here there's 3 modules of each section here, and they're about 90 minutes. Sometimes we go a little long and go to 2 hours. So you have tons of information in there. Again, you can watch it in small bits. We also did a series on the hip, a series on the knee, and a series on the ankle and foot complex. So we put these series together so that you could learn anatomy of the sections that are most pertinent to you. And like I said, so that it's practical. So it's not just, here's the knowledge, go have fun with it and figure out how it works. No, here's the information. Here's how it applies to why your clients experience many of the chronic issues they have. And here's how you apply it to the exercises that you're already using, and maybe some additional exercises that you may not be using, and why that is appropriate for your clients. So we put these series together for you, and we just got approved for CCs for all 6 of these series. And because it's the holiday weekend here in the United States, coming up this week, the 4th of July, one of our most important holidays in our country, if not the most important holiday in our country, we're doing a release sale. This is for the first time and only time this week. You can get each 3 series. So we bundled these series together for you. Head and neck, so that way you understand the forehead posturing and how the anatomy addresses, or should say applies to that area, and how to use the knowledge to create changes in posture and, more importantly, function. The rotator cuff, we'll teach you about the rotator cuff and how the rotator cuff functions with the superficial muscles and how to best train the rotator cuff. And it's not how you've learned or seen on the internet, unless you've been watching our stuff. And then elbow, wrist, and hand. So we basically go head and neck, rotator cuff, elbow, wrist, and hand to address a lot of elbow, wrist, and hands that many of our older clients have. For the lower extremity, we start with the hip. We cover the anatomy of the hip and why some of your clients have hip issues and how that relates to low back issues. And then we go into the knee, because the knee is often reliant upon what happens up at the hip, as well as down at the ankle and foot. We go over the anatomy around the knee and how this relates to the anatomy of the hip to create a better strategy for clients that have knee issues. And then finally, we conclude that with the ankle and foot complex, how we train clients that have inversion ankle sprains, maybe loss of ankle dorsiflexion, which is not a lot of clients, it's actually more foot issues, how to deal with common foot issues like bunions, like neuromas, like just chronic foot tightness. Like a lot of your clients have a rigid midfoot. So you have to understand, like, what's the anatomy that impacts the midfoot, so that way you know where to release. And you're just not randomly saying, hey, go release this, or go do this, or just do myofascial release all over your body because that's what I saw somebody else do. So you actually know how to direct your myofascial release. So you know where and which exercises are most going to impact the region of the body. So we put these packages together for you. And for a special time, you get these 3 modules. So each of these sessions has 3 modules. So there's 9 modules together here. There's 9 modules here in the lower extremity. You get the 46 hours per module. So it's really about close to 20 hours of content in each of these sections. You get anatomy, as I mentioned. So you get the PowerPoint presentations. You get us discussing it and showing you practical application of these muscles. You learn the attachments of the muscles, and more importantly, where they are in the body. You learn the assessments that go with these muscles, so you can assess whether your client is using their muscles appropriately, or what strategy they're using to create that's leading to some of their issues. We also teach you the corrective exercises that will help your client create more optimal posture and movement habits. So you get Q&A. So when we were on live for each of these sessions here, we had clients, the community could call in, it wasn't a call-in show, they could write and type in their questions so that we could answer their questions. So some of the most commonly asked questions, like, why do you not have your clients tuck their pelvis into posterior pelvic tilt, especially your older clients? Why do you not have your clients just pack their neck down when they're doing shoulder exercises or the neck exercises? Why do you not have your clients pull their shoulder blades down and back? If you understand functional anatomy, biomechanics, and motor control, you can answer that question. And you can show through your assessments how it changes range of motion, how it changes function, whether you're using an optimal or suboptimal strategy. So we teach you all that in each of these bundles. We also, like I said, just got approved for CCs. So each of these packages has CECs. I don't want to misquote it. So we have CECs from ACE, NASM, and AFA. And if you're part of the Functional Aging Institute community, they will also provide you CECs for this course as well, or this program as well. So for this week only, each of these is usually $49 to $69. Actually, the price is going up to $69 after this week. You get each bundle. So these 9 modules right here, you get, or these 9 modules for $99. So $99 this week only. This will end on Sunday. It will not be $99 after Sunday. So don't come to us and say, hey, you know, you said it was going to be $99 and it's still $99. Nope, it will go back up to $149 after this week. So this is the best price you're going to get for each of these modules. And again, if you're part of our community, you know that we will always over-deliver. So if you purchase either of these bundles and you don't feel like it's for you, you're like, hey, I don't really learn anything, or it's not really applicable to my community, then you just call us up, no questions asked, we'll refund you, okay? Because we want you to be satisfied. We put our heart and soul into this. This is the information we use with our own general population clients, the clients that come into our office that we teach as part of our Integrative Movement Specialist Certification Program. We know this information works. And Jill is an instructor at this massage school where I used to teach. So she's been a teacher for 20 years. I've been teaching this for over 20 years as well. As I mentioned, we're both in our 50s, so we've been doing this for a long time. What we do very well is we teach, we know anatomy very well, and we teach anatomy very well so that it's easy to learn, it's fun to learn, and it's applicable to your clients. So you can go away from each of these modules, each session of each of these modules, and use the information with your clients. So that way you can really be the specialist in your area and differentiate yourself from the other individuals and help, more importantly, help more clients that have chronic issues. So, Mary's gonna put the link underneath this video. If you have any questions about Anatomy Geeks, if it's right for you and or your clients, feel free to reach out. I'll answer any questions. And again, this is only for this week until Sunday night at midnight. $99, 9 modules of information, head and neck, rotator cuff, elbow, wrist, and hand for the upper body, hip, knee, ankle, and foot for the lower body. Each of these is $99. Lots of amazing information. You get all this information. You get the Q&A, PowerPoint, you get the CECs, which many of you are looking for, CECs for all series, and more importantly, knowledge that will help you differentiate yourself and help your clients, real-world clients. It's not just the athletes that we work with, we prove that this works on everyday clients, and this is the same information we use with our own workouts during our own programs. So we look forward to seeing you in Two Anatomy Geeks. If you have any questions, feel free to write them below. Reach out to helpdesk at Fitness Education Seminars if you have any further questions, logistical questions. Go to the Two Anatomy Geeks. Mary will put the link below this. Get your bundle that applies most to the clientele, or the information that you want to learn and applies most to your clientele that you work with. And we look forward to seeing you in the community. This is Dr. Evan Osar with Integrative Movement Institute. Look forward to seeing you in Two Anatomy Geeks. Make it a great week. Get out there and inspire, empower, and educate your community and be the leader our industry needs. Make it a great day.